Welcome to the Dr. Izzy's Medical Podcast channel.
Question: what is the cell type of origin for a neoplasm that tests positive for epithelial membrane antigen? Answer: epithelium. Question: what is the most common cause of Cushing syndrome? Answer: exogenous corticosteroids. Question: what renal disorder is associated with WBC casts involving mostly neutrophils? Answer: pyelonephritis. Question: which type of hemolysis is associated with spherocytes? Answer: extravascular hemolysis. Question: how does partial pressure of oxygen change in carbon monoxide poisoning? Answer: normal. Question: what is the most common salivary gland lesion? Answer: mucocele. Question: what is the cause of secondary hyperaldosteronism? Answer: activation of the renin-angiotensin-aldosterone system. Typically by renal hypertension, CHF, renal sclerosis. Question: what is the most common cause of death in liver cirrhosis? Answer: esophageal varices, due to the blood loss and coagulopathy secondary to the cirrhosis. Question: what percentage of glomeruli are involved in diffuse glomerular disease? Answer: greater than 50%. Question: how do leukocyte ALP levels change in CML? Answer: decrease. Question: which neuromuscular junction disorder involves muscle weakness that improves with muscle use? Answer: Lambert-Eaton syndrome. Question: what type of amyloid protein is seen in secondary amyloidosis? Answer: serum amyloid A. Question: which HLA subtype has the strongest association to autoimmune disorders? Answer: HLA-B27. Question: what is the gastric acid level in autoimmune chronic gastritis? Answer: low. Question: which bone disorder is associated with the mosaic pattern of woven and lamellar bone? Answer: Paget disease of bone, osteitis deformans. Question: which sex chromosomal disorder is associated with productal coarctation of the aorta? Answer: Turner syndrome. Question: which clotting factors does von Willebrand's factor carry? Answer: factor VIII. Question: what gene mutation is commonly seen in sporadic endometrial carcinoma? Answer: P53. Question: how does intracellular Na change in cellular injury? Answer: increase. Question: what is the prognosis of large cell carcinoma of the lung? Answer: poor. Question: which type of nephrolithiasis involves envelope or dumbbell-shaped crystals? Answer: calcium. Question: what bone tumor is Codman's triangle associated with? Answer: osteosarcoma. Question: what is the most common cause of laryngoepiglottitis? Answer: Haemophilus influenza. Question: what fundoscopic finding below is also found in retinopathy secondary due to benign hypertension? Answer: arteriovenous nicking, and copper, silver wiring of vasculature. Question: which area of the stomach is most commonly affected by Helicobacter pylori chronic gastritis? Answer: antrum. Question: what is responsible for the hypertension seen in the autosomal dominant form of polycystic kidney disease? Answer: increased renin release. Question: which pneumoconiosis is associated with an increased risk for tuberculosis? Answer: silicosis. Question: which two angiogenic growth factors are commonly produced by tumor cells? Answer: FGF, VEGF. Question: what is the cell type of origin of a neoplasm that tests positive for leukocyte common antigen? Answer: leukocytes. Question: what is the translocation of ABL that causes chronic myeloid leukemia? Answer: T922, to be with BCR. Question: what kind of shunt is involved in a ventricular septal defect? Answer: L2R, from LV to RV, then R to L due to Eisenmengers. Question: how do GLC levels change in response to increased growth hormone levels? Answer: increased GLC levels. Question: what renal disorder is associated with the presence of dysmorphic RBCs in the urine? Answer: nephritic syndrome. Question: what gene is involved in nevoid basal cell carcinoma syndrome? Answer: PTCH. Question: where along long bone is giant cell tumor of the bone located? Answer: epiphysis. Question: how do EPO levels change in sleep apnea? Answer: increase. Question: which gender is more commonly affected by Sjögren syndrome? Answer: women. Question: how will cortisol levels change following a dexamethasone suppression test in a patient with an ACTH secreting pituitary adenoma? Answer: decrease. The pituitary adenoma is still able to respond to negative feedback from corticosteroids. Question: Which hepatitis virus is commonly acquired by travelers? Answer: Hepatitis A virus. Question: What kind of casts are seen in the urine of a patient with nephritic syndrome? Answer: Dysmorphic RBCs. Question: How does the PR interval shift on an ECG in acute pericarditis? Answer: PR depression. Question: Which pneumoconiosis is associated with eggshell calcifications of the hilar lymph nodes? Answer: Silicosis. Question: Which enzyme functions to eliminate hydrogen peroxide? Answer: catalase. Question: Which type of inflammation is characterized by the presence of edema and neutrophils in tissue? Answer: acute. Question: What neurological deficits have to be present to meet the criteria for a diagnosis of dementia? Answer: memory plus one cognitive deficit. Question: What type of rapidly progressive glomerulonephritis involves granular immunofluorescence? Answer: type 2. Question: Where are lesions found in the endemic African form of Burkitt lymphoma? Answer: jaw. Question: What type of seronegative spondyloarthropathy commonly manifests after chlamydia infections? Answer: reactive arthritis, Reiter syndrome. Question: Which group of pulmonary disorders involves a decrease in FEV1-FVC ratio? Answer: COPD. Question: Which tumor is associated with the tumor suppressor gene P16? Answer: melanoma. Question: Where do giant cell tumors arise? Answer: epiphysis of long bones. Question: What is a tonsillar herniation? Answer: herniation of the cerebellar tonsils through the foramen magnum. Question: What is the typical presentation of prolactinoma in males? Answer: decreased libido and headache. Question: Which chromosomal translocation involving CMYC can cause Burkitt lymphoma? Answer: T8, 14, with Ig heavy chain. Question: What change regarding ERBB2 causes breast cancer? Answer: amplification. Question: What is the most common form of AMD? Answer: dry, atrophic macular degeneration. Question: How many lobes, pyramids does a normal kidney have? Answer: 8+. Question: What is the most common primary tumor arising within bone in the elderly, greater than 40 to 50 years old? Answer: multiple myeloma. Question: Which inflammatory muscle disorder is associated with anti-AMI2 antibodies? Answer: both dermatomyositis and polymyositis. Question: Which sex is more commonly affected by atherosclerosis? Answer: men. Question: What pattern of necrosis is characteristically seen in tuberculosis? Answer: caseous necrosis, with granulomas. Question: Which neoplasm is associated with hypercalcemia? Answer: squamous cell carcinoma of the lung. Question: Which three autoantibodies are associated with celiac disease? Answer: anti-endomysial, anti-tissue transglutaminase, antigliadin. Question: What translocation involving BCL2 can cause follicular lymphoma? Answer: T14, 18, to Ig heavy chain. Question: What is the duration of acute stress disorder? Answer: 3 days, 1 month. Question: What comprises the histological crescent seen in rapidly progressive glomerulonephritis? Answer: fibrin and macrophages. Question: What type of bilirubin will be elevated in jaundice due to Rotor syndrome? Answer: CB. Question: What is the most common cutaneous malignancy? Answer: basal cell carcinoma of the skin. Question: Which neoplasm is associated with dysplastic nevus? Answer: malignant melanoma. Question: Which sinus is most affected in rhinosinusitis in adults? Answer: maxillary. Question: Which sex chromosomal disorder is associated with a bicuspid aortic valve? Answer: Turner syndrome. Question: Which of the BRCA genes is involved with male breast cancer? Answer: BRCA2. Question: What oral GLC tolerance test result is diagnostic of T2DM? Answer: greater than 200 mg per deciliter, 2 hours after GLC loading. Question: What are the teratogenic effects of cigarette smoke? Answer: growth retardation. Question: Which bone disorder is associated with dense, brittle bones? Answer: osteopetrosis. Question: Which tumor is associated with CDK4 amplification? Answer: melanoma. Question: What is the cell type of origin of a neoplasm that tests positive for vimentin? Answer: mesenchyme.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.